Hello everyone. Today I'm going to discuss about the digital rectal examinations. So that means how we are going to examine the rectum or in the anus, especially for the anal disorders and also who are having some prostate complications. So we have to examine clearly with using the any equipment, or is the manually we have to use the our glove finger, we have to insert into the anus, and also we have to identify any problems related to the anal, like a sphincter problem or any external growth inside the anus in the rectum. And another one, if any prostate gland enlargement, if any anal incontinence or fecal incontinence, or any hemorrhoids also called as piles. So how we are going to assess, so we are going to discuss here. So in the digital rectal examinations, so the definition of the digital rectal examination is a physician insert his or her glove finger into the anal opening to find out the anal or rectal pathology or any prostatic pathology or anal sphincter tone. So if sometimes some people may chance to get the anal sphincter abnormality, muscle loss of muscle tone, or maybe prostate enlargement, or in case of any like a any hemorrhoid, or it's any like a any obstruction of the venous, like a vein obstructions may use the projections like appearance. So that is the hemorrhoids, and also these things are going to be checked with in the rectal examination. So what are the indications of these rectal examinations? So after the all the abdominal examinations, so physicians are going to be assess the and coming to the next one is the rectal examinations. So after examination, so after abdominal, then we can go into through the systematically we have to check for the rectal examination. So especially for the uh, passing bright blood for the rectum. So that is nothing but is the hemorrhoids. So who have hemorrhoids are also called as, simply understanding purpose, we called as piles. So like any ball-like structure or extra projections in the anus. So it may use the painless rectal bleeding. So may chance to get the bleeding inside the rectum and also at the anus region. So they may chance to get the more like a bleeding in the toilet. So this type of indications commonly we can do assessment in the rectal examinations. And also in case of altered bowel habits, so altered bowel habits means is either maybe is a constipation or any diarrhea. Constipation means so is a difficult to pass the feces, or me unable to pass the feces, or maybe it takes maybe 2 to 3 days or 4 days, depends upon the severity. Some people are may habituate to pass the feces maybe weekly once may chance to get. So this is depends upon the like a severity of the constipation, or maybe is the diarrhea. So the frequency of the like a feces, like a excretion, or maybe stools, so it's a liquidy form. So in those conditions also we have to assess properly if it's because of the any intestinal abnormality or any rectal abnormality or any anal sphincter disable and also abnormality, so we have to rule out. And also in case of any prostatic pathology such as the benign prostate hyperplasia, also called as the enlargement of the prostate gland. So we are going to discuss how we are going to assess and also what are the symptoms we are going to assess with the rectal examination. And also anal incontinence. So anal incontinence means is because of the anal sphincter like weakness, or if any nerve injury or any muscle injury, may chance to get the leaking of the stools. So these are the indications for the digital rectal examinations. So coming to the contraindications, so when we should not do the these distal rectal examinations. So in case of the imperfect anus and also after abdominal perineal resection surgery. So if any abnormality in the anus, or maybe is any in case of any like abdominal surgeries or in the perineal surgeries. So in those conditions, so it is a contraindicated. In absolute contraindicated is going to be the acute fissure in the ano. So if any fissures, so fissures means any deep like a the breakage. That means in case of the breakage or tearing of the tissues in the anal regions in the sudden acute conditions. So this is the absolute contraindications. So what are the equipments are going to use in the digital rectal examinations? These equipments are, so first one is the gloves, apron, and lubricants and paper towels. So these are the basic like a equipments to do the rectal examination, digital rectal examinations. So here we have to follow the some sequential steps. So in the sequential step, the first one is going to the introduction and also informed consent. So here we have to introduce yourself to the patient. So if the patient comes, we have to introduce to the patient. So and also tell the patient why and also what you are going to do. So that means we have to inform clearly what we are going to do the like a assessment plan. What is the purpose of the assessment plan? And also while assessing what the complications they may get while assessing what discomforts there may chance to get the in the during the assessment. So we have to explain and also we have to take the permissions and also from them, so what we are going to do and also why we are going to do, explain clearly. So in the second step, so at least the chaperone and also privacy. So that means, so ask for an chaperones. So that means if anybody comes with a patient, any like a caretakers or maybe is accompanying persons, so they should be there and also we have to ask them to stay along with the patient and also maintain the privacy and also by putting into the curtains. So that means, so we have to give the privacy while checking the while assessing the rectal examinations. So we should not be in the open places, so the patient won't be comfortable and also they won't get any privacy. So that is the second step or second like a stage of the assessment process. So coming to the third one, in the third one, we have to wear the PPD, the personal protective devices, and also hand wash, and also wear the gloves. So here we have to wear the PPE or PPD, or we have to wear, and also apron and cap and mask and goggles. So why we have to these? These are the personal protective equipments. So that means we can prevent the some contamination, or if any because of we are going to be handle the like a waste materials like excretory materials in the anal region, so may chance to get the contamination. So that is the reasons we have to wear the we hand wash properly and wear the gloves properly, mask and also goggles, cap, all we have to wear properly, then start the assessment procedures. And also hand wash and also wear the examination gloves. So these are the sequence of the examination in the rectal examination. And also here we have to give the patient proper positioning. The patient should be relaxed positions and also sims positions, that is the left lateral positions. So we can ask the person into the left lateral positions. So sideline positions and also crook here is going to be left lateral positions. Ask them to bring the knees very close to the chest. So this position is going to be is comfortable and also best position for the rectal examination. And also here is the fifth one is the expose the area adequately. So where there we are going to assess that part should be exposed properly with the drape sheet and the remaining part should covered with the drape sheet. And also only thing is where we are going to assess it should be exposed clearly and also adequately. So and also inspect the perianal skin. So here and also before inserting the finger, so we have to check the observe and also we have to observe surrounding to the inserted area, anal area, any skin extractions and excursions, rashes, any rashes, and also hemorrhoids or maybe piles. Is there any outside piles or inside piles? Maybe if there any fistula, any fissures, or any bleeding, any pus formations. So we have to check and we have to inspect around the anal region. So then we have to, after wearing the glove, so we have to going to use the, that means our finger, so we have to insert, so the physician has to use the lubrications. So that means it is a easy to prevent the friction, so and also free movement. So lubricate the index finger with a xylocaine jelly. So xylocaine is a is going to be the anesthetic. So if they get any pain also it won't get much pain, so it is act as a anti-anesthetic drugs. And also it is like a gel, it is going to give the free movements and also friction to prevent the friction. So this is the step 7. So next one is eighth one is going to be, so apply the finger gently into the anal opening into the 6 o'clock positioning. So 6 o'clock position means how the six symbol is going to there. So index finger has to insert into the anus and also check into the 180 degrees. So it's a clockwise and also anti-clockwise. So if we check the rotations to the right and the clockwise and also anti-clockwise, so then only we can easily find the any abnormality in the anal region. So just now we discussed what are the indications, especially for the prostate enlargement, or if any hemorrhoids, or either internal hemorrhoids or external hemorrhoids, and also if any fistula, or maybe in case of in case of any constipation or in diarrhea also we are going to assess, and also especially for the muscle tone of the anal muscles. So if any anal sphincter muscles are, if any loss of tone also we are going to identify through this digital rectal examination. So and also palpate anteriorly in the males for the prostate. So in the anteriorly in the 6 o'clock positions. So in the anterior side, the feel the size and also median sulcus and also in nodule. So here they are going to feel the prostate anteriorly in the male people because of the male having the prostate gland. So this prostate gland may enlarge in the if the age grows. So in these conditions, so that is nothing but if the age grows, they may chance to get the benign prostate hyperplasia. So that is the enlargement of the prostate may chance to get. So this is the 10th stage. In the 11th stage, check the anal tone by asking the patient to grip the palpating the finger. So and also by contracting the perineal muscles. If you put the fingers into the anus, so ask them to squeeze the anal muscles and also contracting the anal muscles. So if the muscle tone is a normal, so they can contract and they can hold the fingers with the anal sphincter. So they can make them into tight the anal opening. So who had having the like a less tone or maybe any nerve injury or any muscle injury, they unable to hold the fingers with the anal muscles. So this is the some complications, especially in case of any after episiotomy, or if any case of episiotomy means during the delivery time, so they may chance to get the surgeons are going to cut the perineal area to open the baby outside to give the space to the baby while delivery time. In those conditions also may chance to get the muscle weakness, or maybe they may chance to get the in fecal incontinence. So that's why we have to check these sequences we have to follow while examining the rectal examination. And also gently remove the finger and inspect the finger for any blood, mucus or feces. So after take out the finger, so we have to find the any blood is there. If they got the blood or any mucus means like a thick secretions or maybe white thick secretions or feces or the waste material. So they have to found out, and also then clean the anal area. So after that, clean the anal area and also wipe away excessive lubricants. So if any lubricants like a xylocaine or any fluids or any bleeding or anything, after that we have to clean properly. So these are the like a sequence of the rectal examinations. So after that, cover the area. So they are going to be recover the patient. So that means after that, ask them to clean and also cover the open area. And next one is the thank the patient and also throw the glove into the yellow color bin. So if the color bin is there, so we have to throw the waste material into the yellow color bin. So this going to be this is a dispose the used equipments into the clinical waste bin. So this yellow color indicates the clinical waste material. So we have to throw into the yellow dustbin. So these are the assessment plans. And also so the inference about the digital rectal examinations. So is going to be just now we discuss the sequential steps. So first one is going to be in case of the enlargement, the smooth spermace and also median sulcus felt. So in case of the benign prostate hyperplasia, that is the enlargement of the prostate gland. And also in case of the prostate, single nodule with the normal median sulcus, so it indicates the carcinoma. So it indicates the carcinoma of the prostate. So it's only normal median sulcus, single nodule. If the single nodule means it may indicate the prostate carcinoma. And also in case of the prostate, whole prostate nodular is a craggy. And also is the prostate is a median sulcus abbreviated means a cancer carcinoma of the prostate. And also rectal and anal pathology and also polyps or maybe is a cancerous rectum may chance to get if they get any polyps. And also anal sphincter, if the tone is decreased, so they may chance to get the fecal incontinence. So these are the inference of the distal rectal examination. We are going to find the if anybody having enlargement or if any single nodule or maybe is the at the medial sulcus or maybe is the the median sulcus obliterated means in case of the carcinoma of prostate. If the rectum or anal sphincter weakness, so we are going to found out with the distal rectal examination. And also the sequential steps again, if we can recap once. So just now we finished all the all the stages. First one is introduce, explain the procedure, and take the informed consent. That means we have to take the permissions with the signature. What we are going to do, we are going to explain, and also we have to give the provide the we have to ask for them to chaperone and also provide privacy if any escort persons, and also we have to give the privacy them. We have to wear the apron, hand wash, and also done gloves. We have to wear the gloves, goggles to prevent the any contaminations, and should be the position should be sim positions, and expose the area adequately. Inspect the perianal skin, especially for the any rashes, any fistula, any hemorrhoids, anything. So any bleeding, any pus formations, we have to check, and lubricate the index finger with the xylocaine jelly, so that is the anti-anesthetic drug. And also either centrally, we have to gently introduce the finger into the anal canal, into the opening to the 6 o'clock position. 6 o'clock position means here this is the 6 o'clock a position, how the six symbol is there. So here are going to do the, if this one is this one, the insert the index finger into the rectum and also anus, and also rotate it in the 180 degrees to right side and left side, clockwise and anti-clockwise, that is the 360 degrees. And also it palpate the anteriorly in the male for the prostate enlargement. And also check for the anal sphincter tone, ask them to squeeze or contract the anal muscles while the finger is inside. And also gently remove the finger, inspect the finger for any blood, any feces, any mucus, and clean the anal area, cover the area after that. And also thanks the patient, throw the glove into the yellow color bin, and also then we have to introduce the digital rectal examiner to the examiner. So these are the sequential steps of the digital rectal examinations. So until now we discussed. So why we want to do all these things? So just now we discussed the prostate enlargement, or maybe any hemorrhoids, also called as piles, or maybe muscle tone loss. So what are the prostate gland enlargement? Actually, what is prostate glands? So just we have to learn about the some knowledge about the prostate gland. So here, because of we have to know the some symptoms and what the causative factor of the prostate gland. So if you see the prostate gland is there in the males only. So is going to be just the below the bladder, urinary bladder. Normally, if you see the prostate gland, so it is going to be just below the urinary bladder. So this is the normal prostate. But if the age grows, this prostate is also going to be increasing the size in the normal conditions. But in case of who having the abnormal conditions, or maybe any health issues, or maybe any hormonal imbalance, or maybe because of the infections, or maybe because of cancerous any other complications, so this is going to be increased. So the enlarge, it may into enlarge, so it may gives the compression of the this urethra, so it may gives the difficulty in the urinations, that means the unable to pass the urinations, and also may chance to get the bleeding, and may give the other severe complex severe pain and symptoms. So actually, what is the benign like a prostatic hyperplasia, or also called as prostate gland enlargement? So this one is like a prostate gland enlargement. Is a common condition in the men get older. This is a very common because of all the men having the prostate gland. So this the main this the main in the day to day life is going, the main the function is going to be, it may increase the size the day by day, so until the age grows. So if it is age grows, so until the some above the 50 years, so it may increasing the size, so after that they may chance to get the complications. An enlargement of the prostate gland can cause the uncomfortable urinary symptoms. So it may give the urinary this may give the urinary symptoms such as the blocking of the flow of the urine at the bladder. So the bladder symptoms are going to be the bladder is going to give the obstruction. They may chance to get the discomfort, unable to pass the urine. It can also cause the bladder and also urinary tract or kidney problems because of the obstruction of the flow, the urine obstruction from the bladder to the ureters. So it may obstruct, and also it may give, because of the obstruction, they may chance to get the urinary retention, and because of the urinary retention, they may chance to get the like a kidney diseases and bladder diseases. And also, if you see the common signs and symptoms of the prostate enlargement, so the prostate is going to be the frequent or urgent need to urinate. Sometimes they may chance to get the frequency, or maybe may chance to get the incontinence, and maybe sometimes increase the frequency of the urination at night time. So that is called as nocturnia. So night time they are going to get the unable to control the urine, and also incontinent, and also difficulties in the starting the urinations. So the initiation is going to be difficult. So because of the enlargement, the ureter is going compressed. So because of the compression, so it may unable to pump the, if you see at the bladder, so there is no passage to the secretion, and also is that is if there is no passage to send the urine outside, so it may gives the discomfort in the and severe pain. So sometimes may chance to get the bleeding also. So and also the weak urine stream, or maybe is a stream that stop and also start. So unable to complete the voiding of the urine. So sometimes they are going to be start the urination, then it's going to be stopped. So there is no flow, proper flow. So because of the obstruction. So maybe they may chance to get the dripping at the urination. So if you want to identify in any enlargement symptoms or urinary symptoms, so if anybody having like a dripping, or if they become the pant become wet, so we can suspect the having any prostate problem in the old age people. And also inability to complete the empty bladder. So that means they are going to be like a is on and off. So sometimes they're going to pass the urine, and also is sometimes going to be get the difficulty. So half of the urine is going to be like a some amount they are going to pass the urine, and some amount unable to pass. So these are the most common symptoms in the prostate enlargement, also called as benign prostate hyperplasia. The less common are the urinary tract infection and inability to urinate, blood in the urea. So these are the less common signs and symptoms. So this urinary tract infection, because of the urinary retention. So if not clearing the blood in the bladder, so what happened? The urine is going to be stagnated in the bladder. So if any waste material stay prolonged time in the bladder, so it may produce the infections. So this is the causative factor for the urinary tract infections. For example, in our home, if you are not cleaning your kitchen dustbin, or if you are not clearing the your whatever the waste material from your house, so how our house is going to be become spoil, or maybe foul smell, same thing is going to be happening. So because of the if there is no clearance or passage of the urine, so may chance to get the urinary tract infections. And also because of the obstruction, they are unable to pass the urine. And because of this, if they're trying to, if they while voiding or the passing the urine, if they strain a lot, so may chance to get the bleeding. So these are the common symptoms, are very less common symptoms in the prostate enlargement. So, what are the causative factors for this benign prostate hyperplasia or enlargement of this one? This is the very actually normal in the male patients or male persons, because of the is going to be the throughout the life this prostate is going to be may enlarge. So this is the part of natural aging process. It's not a is abnormal one because of increasing the androgen receptor. So it's a male hormonal problems. So it's going to be a natural process, natural aging. So it's not because of the abnormality. It's a normal process. But maybe is a dihydrotestosterone may plays in the role. So because of any abnormality of the dihydrotestosterone, maybe it slightly is may chance to get the this like a prostate enlargement. So this cannot be prevented and can be treated. So this going to be cannot be prevented because of this a natural aging process. Everybody is going to face the same problem. But if you take some precautionary measures from day to day life onwards, so maybe we can slightly prevent the complications. But we cannot prevent completely. So it's going to, but if they get problem, can be treated easily if you diagnose the problem early. So other causative factors are, so these are going to be, this gland is located beneath the bladder, just now discussed. So the tube that transport the urine from the bladder out of the penis passes through the center of the prostate. So what happened here? The prostate is going to be enlarged. It blocks the urine flow. So if the most men having the continued prostate growth throughout the life. So it's throughout the life the natural process only. So it's going to increasing the size of the prostate. So in many men, this condition growth enlarges the prostate enough to cause the urinary symptoms to significant block the urinary flow. So the only thing is enlargement. If the enlargement, it may block the way to the passage of the urine. So that is the only causative factor. So because of these causative factors, they may chance to get the urinary retention and also kidney problem, and also may chance to get the bleeding. So it isn't entirely clear what causes the prostate to enlarge. However, it might be due to changes in the balance of the sex hormone as men grows older. So if the age grows, the sexual hormones maybe is a loss of the balance. So because of these things, the changes in the sexual hormones, they may chance to get the this prostate enlargement. So only that is the causative factor, but this is the natural process. Everybody is going to face the same problem. So, who are going to get these complications or risk factors? Who are going to get the prostate enlargement? So, in case of the aging, for example, who already reached the above 40, so those people are going to get may chance to experience the moderate to severe symptoms at the age of 60, and about the half of by the age of the 80. So if you see it going to be start the symptoms in the rarely in the before the age of 40, but if it reach to the 60s, the moderate symptoms they may feel, but in the 80s half of the people may chance to get the prostate enlargement. And also family history. Having the blood relatives such as father or brother with a prostate problem means so you may chance to get the have the problems. So in the family history of the family, if any brother or father, if anybody having the same problem, so may chance to get the prostate enlargement. So other comorbidity factors are such as the any heart diseases and also diabetes also is a one of the causative factor for the this prostate enlargement. And also lifestyle also plays major role in the overall the health, especially the obesity. So in case of obesity also because of the accumulation of the fat or BMI increasing, so may chance to get the other systemic disorders. So because of other systemic disorders also, so may chance to get the other complications. So while exercise can lower your risk, so if you do the exercise regularly, so that means we are going to improve the blood circulation, metabolism is going to be increased. So if we control the weight like a control or the fat depositions, so we can automatically we are going to reduce the other factors, comorbid risk factors such as the heart attack or strokes. So this may helpful to reduce the benign like a prostate hyperplasia also called as enlargement. So these are the symptoms most commonly everybody is going to face in the 70s and 80s of age group. So here, so why we have to know? So those people are going to be indicated to the rectal examinations. So with the rectal examinations, we are going to rule out are they having any enlargement or not, or if they having any other complications related to the anal disorders, we are going to rule out, and also we are if we rule out, the treatment plan will be easy, and also we can prevent the further complications. So, what are the complications in case of the this prostate like enlargement? So, most commonly is a sudden inability to urinate. So, if we just now we discussed is going to compression of the ureter, and also so this is going to be may child unable to pass the urine. So that time, so they need a one catheter and insert into the catheter into the bladder. Then only they can easily drain the urine. Otherwise, there may chance to get the like a retention and also may chance to get the urinary tract infection. And also some men needs the surgery to relieve the urinary retention. If it's retained sometimes, if the catheter is not working properly, if unable to drain the urine, so those people need the surgery to prevent the further complications. And also another complications are the urinary tract infection. So we already discussed. So this is because of the retention of the urine. If the urine is not cleared properly, so they may because of the stagnation or because of the prolonged stay of the urine in the bladder, so may chance to get the urinary tract infections. So if it is frequent urinary tract infections, so they need the surgical procedure, removal of the prostate, or maybe any like they are going to resect the through the surgical procedures, or maybe they are going to apply the give the some special treatment to give the space to the passage of the urine. and also may chance to get the bladder stones, kidney stones may chance to get. So this is caused by the inability to complete the empty of the bladder. If there is no complete evacuation of the bladder, so it may chance to get the stone formations. So it may, these stones can cause the infections, bladder irritation, blood in the urine, and also obstruction of the urine flow. So if any stone is there, the already the flow is very less, the space in the ureter is the very less. So if the already stone formation, if the stone comes and also obstruct in the flow, so it may use the obstruction of the urine flow. Because of the obstruction, if they strain, so they may chance to get the bleeding. So these are the more common complication in the prostate enlargement. Coming to the bladder damage, so if the bladder is hasn't emptied completely, so and also can stretch, so it's going to be because of the no is no empty, so what happened, the bladder is going to be expand. So every day, like this much of extra amount of the fluid is going to be stored, so the bladder is going to be expand. And also it's because of the expansion of the bladder continuously, so the bladder muscles are going to become weak. So because of this bladder muscle weakness, so may chance to get the damage, so unable to contract and relax properly. So in this condition, bladder will get the damage. And another complication is the kidney damage. Kidney damage is because of the pressure in the bladder, so they may chance to get the urinary retention. So it is urinary, because of the urinary retention, so the damage of the kidneys, and also allows the bladder infection to reach the kidneys. Because of, if the stagnation of the urine inside the bladder, so that is nothing but is a host, is a easily they are going to be host for the like infections. So that means is automatically they may chance to get the infection. This infection may spread to the kidney, so the kidney may chance to do get the damage. So these are the major complications of the prostate, like enlargement. So that is the reasons with this examination we can easily understand where they're having the problems, and we can analyze. And also another examine in the examination we are going to use for the hemorrhoids purpose. Actually, what are the hemorrhoids? So hemorrhoids also called as piles. So that is nothing but is the extra projections in the rectum and also anus. So this is the like also called as piles, is a swollen veins. So if you see here the venous structure, like a venous plexus, so this venous plexus are going to be enlarged or becoming the swollen. So into your anus and also lower rectum, and this is nothing but same like the varicose vein. How in the, how it will be in our lower limbs and the legs, how the veins are become weak or maybe distended or enlargement. Same thing happening in the rectum. These are called as the hemorrhoids. So these hemorrhoids can develop inside the rectum. So if you see here inside the rectum, so this is called as the internal hemorrhoids. If it is happened in the outside, if it projects outside, so these are called as the external hemorrhoids. So nearly 3 out of 4 adults will have hemorrhoids from time to time. So if you see in the most of the people are in the throughout the life, anytime they may chance to get the hemorrhoids, but some hemorrhoids are going to be serious complicated hemorrhoids, and some are going to be maybe they're going to be like a disappear within the some time period. So but only thing is depends upon the severity, it may give the complications. So what are that we are going to we are going to discuss here. So hemorrhoids is nothing but is a hema means the blood and roids means the flowing is a rose. So that is what the blood flow is going to be happening because of the obstruction of the in the veins or because of the abnormality in the veins. So it may gives the bleeding. So that's why the name it came is the hemorrhoids. Hema means blood and rose means flowing. And also the normal terminology is called as piles. The pila means a ball or maybe swelling. So in the anal canal, we are going to find like any swellings, so which are maybe or may not be bleed. So some these hemorrhoids or piles, some piles are going to give the like a bleeding, or maybe it won't give the bleeding. So there, this depends upon the severity of the piles. So what are the different types and as how it's going to be happen, we will discuss here. So most commonly where they are going to get the piles. If you see the anal structure, for example, here anus, so is going to be is the left lateral area, and also right is the posterior area, right anterior area. So this area is the, if you see the surrounding to this anus, the bluish color, this one is, so these are the veins So this is a venous plexus. So if any compression to these veins, the everyday day-to-day life, any compression because of the prolonged sitting or prolonged standing, or if because of any constipation, unable to pass the stools, or maybe is because of the improper diet. So many reasons we are going to discuss one by one here. So if you see the venous plexus or the venous drainage in the anus, so many they say internal rectal veins. So these are going to be these rectal veins. So is a middle rectal vein. So these veins, the many plexus are there surrounding to the vein, like the rectum and also anus. So if any pressure, everyday pressure in the venous plexus, so it going to get the like a enlargement or pressure, micro pressure. So it may use the like a distension or enlargement of the vein. So that is the mechanism of the hemorrhoids. So if you see the causative factor for these hemorrhoids, so these causative factors are the major causative factor of the straining. Straining means if anybody having avoiding the feces or maybe toileting time, if they put the more stress while defecation, so while going the toileting time or defecation, if they put more pressure or straining, so they may chance to get put the more pressure on the anus and rectum, so it compress the veins. So that also one of the causative factor. And in case of constipation, prolonged time, constipation means if the difficulty pass the feces like a easy way, or they may sometimes maybe 2 days to 3 days to one time they're going to pass the motion or feces material, the waste material, or maybe some is depends upon the severity, some they are going to pass the tools maybe weekly once. So are sometimes difficult to pass the fecal material. So these are the one of the causative factors. And also is a lavatory sittings. So and also who already using the lavatory sittings, so sometimes it may won't give the bowel movements. So this is also one of the causative factor. And also trauma aging. So in case of any injuries or any in the age group, also may chance to get the this like if you go age grows, if they get any injury, so they may chance to get the hemorrhoids. And also diarrhea also. So diarrhea also one of the causative factor. So if the frequent like is uh, diarrheal symptoms also may give the compression over the venous plexus area, so may chance to get the hemorrhoids. And also lack of fiber rich diet, so this is the commonest problem. So many people are is nowadays is using like a having like a non-vegetarian food, or maybe high diet like a high protein diet, or maybe like a food product such as the cheese and also the milk products or dairy products. So these products are going to be have the zero amount of the fiber. So because of the zero amount of the fiber, so if there is no fiber, there is no free movement of the fecal materials. So it may use the like a tightness of the fecal materials. So it may use the constipation. And also some people may chance to get the hereditary. If anybody having family history, so in the family members or mother or father or brothers, so those like in the family members may chance to get the hemorrhoids that in the family history. So secondary causative factors are, so especially the local complications and also abdominal complications. So local complications, that is the regional ones, is the anolectal deformities, hypotonic sphincter. So if any abnormality in the anus and rectum also may chance to get the like a hemorrhoid formations. And also in case of any abdominal problems such as the ascites, that is accumulation of the fluid in the abdominal cavity, so is excessive accumulation of the fluid in the abdominal cavity also, so may chance to get the secondary complications. And also in case of the pelvic related complications, in case of the pelvic complicated especially is the gravid uterus. So in case of pregnant women, so because of the pregnant women, so many physiological changes is going to be happening. So in those conditions, so they may chance to get the in the hemorrhoids during the pregnancy period. So after the delivery baby, so they may subside the problem and also they become normal. And also in case of any uterine neoplasms, any cancerous in the uterus, or any ovarian uterus, that is the ovarian neoplasms. So these are also some of the causative factor for the hemorrhoids. And also next one is the pregnancy, the portal hypertension, and neurological conditions. So in case of like a any distension or any like a blood pressure is increased in the the veins, so may also chance to get the hemorrhoids, especially if any the in the anal veins, if any pressure increased, so may chance to get the secondary type of secondary like a hemorrhoids. In case of neurological injury such as the paraplegia or multiple sclerosis, or maybe in case of hemiplegia, so these things means neurological and brain involvement and spinal cord involvements, so they may chance to get the diarrhea and fecal incontinence, or some people may chance to get the constipations. So may these are the some causative factors. So we can easily, so we can know the what are the causative factors, so we can know if we identify is it because of the sphincter muscle problem or because of the dietary problem, or if any other like a neurological problem, if we diagnose properly, so the treatment will be very easy. So, what are the theories in the hemorrhoids? So, how why they are going to get the like a hemorrhoids? So, the first one is the portal hypertensions. The portal hypertension and also varicose vein. So, that is nothing but the increase the pressure in blood pressure within the system of the veins. So, the veins are in the normally the pressure is less in the veins compared to the arteries. But in case of if anybody having the more pressure in the veins, so they may chance to get the hemorrhoids. And also upright posture of the human beings, so who are like a their occupational environment like in the standing jobs, or maybe prolonged standing jobs, especially traffic police or nurses or teachers, and also and nowadays is most probably who already working in the outside like in the project like a in the industry workers, so prolonged time standing also may chance to get the hemorrhoids. And also who are having the hyperplasia of the corpus cavernosum recti. So, if any abnormality, any excessive of hyperplasia, enlargement in the corpus cavernosum rectus also may chance to get the hemorrhoids. And also erosion, weakening of the wall of the veins due to infection or secondary trauma. Secondary. So, is if anybody having the any damage or any erosions or breaking of the due to because of infection also may chance to get the hemorrhoids. Hard fecal matter obstructing the venous return. So this hard fecal matter means nothing but is constipation. So because of the constipation also they are going to be obstructing the venous return. Raised anal canal resting posture. So that means who are can sit continuously or prolonged time, or especially desktop jobs. So if they sit continuously 8 hours, so the pressure is more on the anal, and also if the raise the anal canal resting pressure, so it may gives the hemorrhoids. So these are the some proposed theories, not exactly is a 100% causative factors, some theories, and these are the some the researchers proposed these theories. So and also here the complications are going to be they are going to difficult to evacuate. So and prevalence is going to be 5%. Peak of the prevalence is between the age of the 45 under 65. In between the 45 and 65, then people may chance to get the hemorrhoids frequently. And also before the 20 age group is very difficult. So they may won't get that much of if they have constipation or anything also they may won't get before the age of 20. And also is especially for the Afro-Caribbean people may chance to get so these hemorrhoids are more common than the other people. So if you see here how the symptoms will be, the symptoms are going to be the earliest symptom is going to be the bleeding because of the enlargement. So it's going to get the bleed, and if it is serious, so if it is increasing, so they may chance to get the discharge, and also is a pruritus. So that means the is a infection and also inflammations, and also it means severe condition may chance to get the prolapse. So if this all these condition is going to give the pain. So if the enlargement, if they may get the infections, it may give the severe pain. If no infection, hemorrhoids won't produce the pain, but if it's get the infected, so may chance to get the severe pain. So here is going to left lateral decubitus positions is going to be the best positions, and also is also any rashes and also condylomata or eczema or any abscess or may chance to get the fissure and also fistula. So who already having these may chance to get the complications. So the resting tone of the anal canal we have to check, and also voluntary contractions of the puborectals, And also is the external anal sphincter you have to check. Just now we discussed in the rectal examinations. So that is the reasons. If you understand about the hemorrhoids, at least we can know so what type of hemorrhoids, where exactly we found the internal hemorrhoids and also external hemorrhoids. So that is the reasons. So if you have some knowledge about the hemorrhoids, so the distal rectal examination will be very easy. So in the examination part, so we are going to use the proctoscopy. So with this proctoscope, so we are going to check the where exactly having the problem. Is it the inside the rectum or anus or internal hemorrhoids or external hemorrhoids? So and also other than these, the proctoscope are going to use the flexible sigmoidoscopy. So this flexible sigmoidoscopy is nothing but is a one catheter, small catheter with a video guideline with a video. So we are going to check the we are going to assess the rectum and also anus and also colon also going to be we are going to examine. So where they're having any complications such as the any carcinoma or any other enlargements. So we are going to find with these investigation procedures. And also is evaluation under anesthesia in acute pain. So they are going to we can give some so physicians are going to give the some anesthetic drugs so to prevent the pain, and as well as they are going to checking the causative factors and also any abnormality in the anal rectal. And also is the anal is a manometry also. This also we are going to use. So this is going to be like a rectal balloon expulsion test. So this is used for the diagnosis of the any defecatory disorders. Any defecation problem is there. So this is mainly for the to reduce the anal pressure at the rest and during the squeezing in the fecal incontinence. So this is going to be inserted inside the rectum. So with the distal, this is going to be the balloon is going to be expulsion. So it's going to give the some abnormality. We are going to find out is there any tone problem or is maybe is because of the any defecating problems. We can easily find with the anorectal is a manometry. So these are the some physical examinations while examining the anorectals. So these are the procedures. So if you see that these hemorrhoids are going to be different type of the hemorrhoids. So just now we discussed the internal hemorrhoids and also external hemorrhoids. If internal means, so here into the up to the some extent is going to be, if you see the dentate line, so here dentate line is there. This is the rectum and this is the anus and also anal sphincter muscles. So this is the dentate line. So if anything occurs, so above the dentate line, we call as the is the internal hemorrhoids. If the any like a hemorrhoids comes from the below the dentate line, so these are going to be the like called as the external hemorrhoids. So if you see these things, so we can easily understand. So the external hemorrhoids are going to come outside. So those people are going to palpate the hemorrhoids out of the anus. So it may if it is infected, so may chance to get the severe pain. So this is the understanding about the different types of the like hemorrhoids. So this is going to be the external hemorrhoids below the dentate line. And also is the varicocytes of the vein draining, same like the varicocytes, and also inferior rectal artery. So is going to be is supplies to the inferior rectal artery. So these are going to be lined by squamous epithelium. So this is going to be the more painful. So is a little bit the bigger size and also more painful. So may chance to get the thrombosis in the vein rupture. So if they rupture of the vein rupture, so they may chance to get the thrombosis. Maybe they may chance to get the bleeding and blood clot. So if the blood clot is going to be infected, so may chance to get the severe pain. So in case of internal like a hemorrhoids, so this going above the dentate line here. So here also going to be varicocytes of the vein draining, and also superior rectal artery also it's going to supply these areas, and also lined by columnar epithelium. So this also pain insensitive. This one is going to be less pain, so they may won't produce the pain also, but may prolapse outside anal canal the prolapse or maybe is a hemorrhoid. So that means sometimes it may prolapse into the anal canal. So these are the rectal regions. It may prolapse outside from the rectum into the anus. So that is called as the internal hemorrhoids. So if you see the classification, the severity of the hemorrhoids, so we can see the four grades of the hemorrhoids. So these four grades are going to, grade one is going to be not prolapse, is going to stay in the like a in the rectum. So it's going to be only the, it won't produce the pain and also discomfort, but it's going to be the grade two. These the hemorrhoids are going to come outside while defecating. So after the defecation, again these hemorrhoids are going inside. So spontaneously return going to the spontaneously. And also third one is going to be, if you see here, is going to be enlarged and also is manually returned. So that means while defecating, these hemorrhoids will come outside of the anus. So if they push these hemorrhoids push inside, so it go inside. While defecating come outside, will come outside, and if it push it, is go inside. It won't give much complication. But in case of severe, so this is the like a grade 4 one. So if while defecating, it may will come, and also it may stay outside. So that means it won't go inside. So these are the four types of categories. So depends upon the size, and also depends upon the infection, it may produce the symptoms. So if it is the infections, or if it is the prolapse, so it may chance to get the ulceration or maybe thrombus formations. So may chance to get the severe pain, and also sometimes it may chance to get the gangrene or severe pain. If you see here, this is a thrombosis, that means the blood clot formation. After that, it may chance to get the infection. So this type of is going to get the severe pain. So in those conditions, they are going to feel the severe complication. That means unable to sit. They are going to feel the severe pain and also discomfort. So these are the is a prostate like a enlargement, and also is a hematoma formations because of the severe hemorrhoids. So these are the some types of the different types of the hemorrhoids. So if you know what type of hemorrhoids, so while examining the anal examinations, so we can diagnose properly, and also the treatment plan also will be easy. So that is about the importance of the investigation or diagnostic process in the rectal examination for about the hemorrhoids. So another causative factors, what we are going to find about the constipation. So these are also one of the causative factors for the are causative factor for the hemorrhoids. So this constipation is most commonly occurs when the waste or stool moves too slowly through the digestive tract or cannot be eliminated effectively from the rectum, which may cause the stool become the hard and also dry. So because of is difficult to move the passage of the stools, or it may be very slow. So because of these things, it may hard and also it may dry. So that is the reasons unable to eliminate the waste material from the rectal and also anus region. So what are the common complications, or what are the common causative factors for the constipation? So especially for the low fiber diet, particularly is a diet with the meat and milk and cheese. This is a healthy diet actually. This is a protein diet. But in case of along with the protein, if they take the fiber diet, so it will be good, and also easy to pass the waste material from the rectal and also anus. If only purely if they take the meat and also these milk products, so if there is no protein, if there is no fiber, so no passage of the fecal material is very difficult. And also dehydration, if anybody having taking the less amount of the water also may chance to get the constipation. And another one is lack of exercise. If the lack of exercise, there is no movement in the intestine, proper movements in the intestine, so may chance to get the decrease the motility, so it may gives the constipations. Delay the impulse to have the bowel movements. So if any bowel movements are delayed, so may chance to get the constipation. At traveling or any other changes in the routine, for example, if any busy schedule, or normally if you wake up in the morning, our like a intestinal movement will be there in the morning, early morning. So that time if you go toileting, so it's easy to passage of the stools, very easy. And also if you give it more pressure with any like a intake of the water, warm water, it may stimulate the intestinal movement, and also easily to pass the stools. But who already having any like a busy schedule or any changes in the routine, so sometimes unable to do the regular the stool bowel movement, so may chance to get the constipation. And also some other medications also may chance to give the constipations. So some and side effects of the constipations, such as the some high calcium antacids and also pain medications. So these are going to either increasing the like a water that means retention, or maybe is going to may chance to get the dehydration, or is may chance to get the constipation. And also in case of pregnancy, some physiological changes are during the pregnancy. If they use some medications such as the iron medication, also may chance to get the constipation. So these are the causative factors for the constipations. So if you see the different types of these like stools, we can understand what is the severity of the constipation. So these are according to the Bristol stool chart. So we can see the 7 types of the like a category, 7 types here. In case of if they anybody having the separate hard lumps in the stools, so that means the stool like a lumps, like a ball structure. So this is the type 1. So this is indicating the severe constipations. So they are going to pass the stools maybe is 4 to 5 days, or some people are going to weekly once. So that is a severe constipations. So and also lumpy and also sausage like. So it's going to be like a lumpy or like a ball like structure, and also sausage like appearance. So this is the mild constipations. And also in case of the a sausage shape with the cracks into the surface, if you see a sausage appearance but cracks, so this also it's not a it's a near normal actually, but the normal one is like a is a smooth and soft sausage or like a snake appearance. So this is the normal appearance of the stool. Or if anybody having tightness, these things are abnormal. So and also if anybody having the soft is a bobs with is a clear cut edges is going to be the lacking of the fiber. So they may because of the lacking they may chance to get the like the soft blobs. And also the mushy consistency with the ragged edges is the mild diarrhea. So is maybe because of the any infection or may chance to get, or maybe complete leak. The liquid consistency is the severe diarrhea. So according to this chart, so we can easily understand the patient's constipation stage. So that's the reasons while some people who have the severe constipation unable to pass the like a stools, so sometimes they are going to take out these tools with the fingers, the self take out these tools. So that is the very difficult complicate, this is the difficult problems. So unable to pass the stools, so they are going to insert the self insertion of the finger into the anus, they are going to take out these things in the severe type. So if may this type of problems may give the severe like a hemorrhoids complications. So this also is a vice versa, because of the constipation they might chance to get the hemorrhoids, or because of the hemorrhoids there may chance to get the constipations. So both may happen. So why we are learning all these things? If you understand all these things only while assessing the rectal examinations, we can predict and also what the causative factor, and also we can interfere the conditions. So and also diarrhea. So this diarrhea is also one of the causative factor for the about any infections, or maybe it is characterized by the loose watery stool, or maybe frequent also is the need to have the bowel movement. It is usually lasts a few days and often disappears without any treatments. So if without treatment also if anybody get diarrhea, they may recover with 1 or 2 days. It may clear the problem. But in case of acute diarrhea occurs when the condition lasts for the 1 to 2 days. The diarrhea is the result of the viral or bacterial infections. So sometimes it may be because of the bacterial viral infections. So it may other times because of the any food poison also may chance to give the like a loose stool appearance. There is a even a condition known as the traveler's diarrhea. Sometimes if they travel from one place to another place, so they may chance to get the diarrhea or frequent passage of the stools, and which happen when you diarrhea after being exposed to bacteria or parasite while on a vaccination sorry while a vacation in the development nations. The acute diarrhea is fairly common. Normally, in the developed countries, if they travel from one place to another place, so may chance to, if you go vacation, so they may chance to get the travel diarrhea. And also some cases of the celiac diseases, such as if anybody allergic to the, uh, especially for the glutinous food material, so may chance to get the diarrhea. So this also one of the causative factor for the diarrhea. Is it because the viral infection, or maybe bacterial infection, or because of the any like a diet abnormalities? So these causes are going to be the food intolerance. So sometimes the food problems such as the lactose intolerance, any food allergy, any medication reactions, any viral infections, bacterial infections, intestinal disease, parasitic infections, and also if any gallbladder or stomach surgery also may produce the diarrhea. So if anybody get the diarrhea, the main symptoms are going to be the nausea, abdominal pain, the cramping pain inside the abdomen, and bloating. They are going to feel the fullness, heaviness in the stomach, dehydration because of the frequent passing of the stools. The water content is going to be lost. So this is the very dangerous complication in the diarrhea. So because of the diarrhea, they may chance to get the electrolyte imbalance, so those people may chance to die. And also fever, blood stools, frequent urge to evacuate the bowel, and large volume of the stools. So these are the common symptoms who are having the like a diarrhea symptoms. So, and also other complications are in this one is the fecal incontinence. So, unable to control. So, they may, because of the weakness, the stools are going to be liquid. So, may chance to get the incontinence. And also the stool may leaks. So, it may be because of the any like having the problem inside the like a rectum, or maybe unable to control the anal sphincter, may chance to get the leakage. And also this is depends upon the person to person vary. In the woman, is going to be more common than the men. So this fecal incontinence is used if any other situations. So in these conditions, stool leaks out when the passing the gas. If they are passing the gas, so sometimes the stools may leak. And also in case of physical activities, while exercise or any exertion, also may chance to get the leak. And feeling, and also like you have to go and not being to able to make in the bathroom in the time, also you may chance to get the leakage. Stools is seen in the underwear after the normal bowel movements, so sometimes may leak also. So there is a complete loss of bowel control. So in case of any nerve injury, they may chance to get the complete loss of bowel control. So these are the problems in the diarrhea. So the frequent diarrhea, so the complications are going to be so the frequent diarrhea, constipation, or any muscle damage. So who are having the complete frequent diarrhea and constipation, it may give the damage to the anus and it may give the weakness. So this may give the incontinence, the fecal incontinence, or any muscle damage. So the muscle damage can occur during the difficulty vaginal birth. So that is episiotomy. If the vagina cut during the baby like a delivery time, if the baby the birth canal is small time, so this also may chance to give the damage in the muscles, so it may chance to get the incontinence. And also next one is the older age. So older age people are going to get the may prone to the damage of the rectum, or if the age progressions, so may chance to get the incontinence. And also damage of the nerves, so especially in the vaginal delivery, so during the normal delivery, so they may chance to get the stretch of the nerves, or maybe some surgical procedures may give the damage to the nerves. And also they may chance to get the constipations, so those people are may chance to get the this diarrhea or the stool leakage. And also some of the neurological disorders such as the multiple sclerosis and stroke or spinal tumors also may chance to get the this leakage or maybe the diarrhea. So other causative factors are is going to be the some rectal prolapse. Who are having the rectal prolapse, the rectum is going to be damaged. So rectum falls down into the anus. So rectum falls into downwards. So that is the rectal prolapse. Or in called rectocele. So rectal seal is the rectum pushes into the vagina in the females. So in those conditions also they may chance to get. And also other causative factors, if any laxative abuse or any radiation treatments, any nervous system damage, any congenital defects, inflammatory conditions, or any bowel diseases also may chance to get these complications. So that is about the abnormality or stool leakage or anal sphincter muscle control. So these are the causative factors. So these all these problems we are going to assess through the our rectal like in the distal rectal examinations. If you have some idea what are the problems here, so we can easily understand about the how to perform the distal rectal examinations. So these are the some positive factors of the diarrhea and also constipation, anal and also sphincter muscle weakness, and in about the hemorrhoids and prostate enlargement. So these problems we are going to assess through the rectal examinations. So if you understand what are the abnormalities of the rectum, so we can easily found the what abnormalities in the rectal examinations. So that's all about the rectal examination, distal rectal examinations. So hope you are understand clearly. Thank you very much. See you in the next class.